EDSvideo.com. Thank you.
The next thing I want to talk about is why I think emergency medicine doctors are the most rounded doctors. Now, of course, we're not the experts on any one specific field. If you ask us about ankle fractures per se, then of course the orthopedic is going to be the expert on that. If you ask us about melanoma, sure, the dermatologist is going to know a lot more, the oncologist is going to know a lot more. Ask us about a delivery of a baby, and of course a OB/GYN physician is going to be the expert in that field. However, emergency physicians have to know about those conditions enough to treat, to stabilize, and to refer those patients that need additional help. But those that don't need additional help, you need to treat them completely and thoroughly. You have to know enough about that. So we have to know about obstetrics and gynecology. We have to know about pediatrics. We have to know about trauma. We need to know about cardiac disorders and CHF and treat an acute MI or heart attack. We need to know about strokes and acute treatment, who doesn't need TPA. We need to know a lot about sepsis and aggressive IV hydration, and procedural skills have to be high on an emergency doctor. We have to put central lines. We have to be able to do resuscitation like no other physician in the hospital, CPR, medications, aggressive hydration and things like that. So no, by no means an emergency doctor knows more than a surgeon about appendectomies, but we know a lot more about us than a surgeon in terms of the diagnosis of appendicitis, about knowing that 200 patients we saw with belly pain, the one patient that we think might have appendicitis, we get the proper CAT scan, we see a patient with atypical symptoms and we still order a CAT scan and whoa, it's appendicitis. The surgeons have a selection bias. They only get consulted for the cases we already know the diagnosis on. So they only know that, oh, this patient has appendicitis. Okay, well, their exam is this and that. Because usually we're the ones making that diagnosis. Sure, there are some difficult cases we consult them on for their opinion to see what they think it is appendicitis or not. But for the most case, we have to be the ones making that differential diagnosis and that initial diagnosis. For example, pulmonary embolism. We know more about the diagnosis and non-diagnosis of pulmonary embolism than any other physician in the hospital. About diagnosing and treating kids with a fever. Yeah, 99% of the kids with a fever are going to be fine, but that 1% we need to be really alert for. Pediatricians, they only get called or consulted on the ones that are really sick. So that's a selection bias, and that's something that ER doctor doesn't have the privilege to have. So we really have to know our stuff so that we know who to and who not to call the consultant on. So that's why I think ER doctors are so well-rounded. The other good reason is the ACEP, the American College of Emergency Physicians. It's very hard on the continued medical education. We not just have to get CMEs, so many a year, but we actually have to get special LLSA, which is like 12, 13 articles every year we have to read and do a test on. Top of that, every year we have to do that test, and then every 10 years we need to recertify on our board. So it means we have to sit for a test and prove that we know what we know. Top of that, hospitals usually ask us to keep our basic life support, advanced cardiac life support, our pediatric life support cards. Some hospitals have us keep ATLS, advanced trauma life support, and there's just so many requirements of continued education that we really know what we're doing. We're really keeping up to date with new literature, with new guidelines, management. Not only that, but hospitals, they're breathing on their neck with requirements in terms of risk management and proper documentation. We're doing education on stroke because of core measures and getting it right in stroke certifications for the hospital. We're re-educating ourselves on STEMIs all the time so that we have the best numbers and the best outcomes in terms of patients presenting with acute MIs and heart attacks. So we are constantly being bombarded with information, learning and relearning what we know. And that's why I think emergency doctors are just top-notch doctors, well-rounded doctors. By no means I'm bashing any other specialty, but I truly enjoy what I do. I get to do minor surgery, I get to do pediatrics, geriatrics, get to treat pneumonia and sepsis all in the same day, which is pretty
EDSvideo.com. Thank you.